In 5, 4, 3, 2, 1. Hello, everybody, and welcome to another episode of the Moon Tea Podcast with your co-hosts, John and Hugh. We are here to talk about craft, community, and building meaningful careers. Today, we have Jackie Tran, also known as JT, Jack Attack, and a phenom in the water for backstroke. With that,
JT.
JT. With that, JT, let me introduce you really quick. So we went to college together and Pomona College. We swam on the swim team together, and we ended up on like the same study abroad in Edinburgh and traveled around Europe. And she's in the healthcare industry, medical industry, and has a master's in health and public policy and stuff like that. I hope Jackie will correct me and update me. I'm not the best at the intros, but hey, John hasn't met Jackie yet, so they're going to get to know each other too. I'm really excited for the episode. JT is one of my closest friends. And let's begin. JT, hi, how are you?
Hi, happy to be here. Thanks for having me.
Nice to meet you, JT.
Nice to meet you. Of course, I will do anything for Hugh.
Man, I'm a terrible friend. Yeah, so I'm really quickly, let's just get through all the facetious stuff and all the facade. Like, what is it that you do these days? Quick bio on you. How much did I butcher your background? Go.
But yeah, so I mean, most people don't really understand what I do, so I don't.
Classic.
I end up not really explaining it at all. I just gloss over. I was actually good timing. I was going over my resume today because I'm trying to figure out my next life step. So I have a master's of science in public health as my background, studying maternal child health and sexual and reproductive health. And then right now I currently work for New York Presbyterian Hospital in New York City, and in the Department of Government and Community Affairs. So I work directly in the Government Affairs office, where we work with lobbyists, we work with our elected officials, we advocate for policies benefiting the hospital and the patient community they serve, and write memos, follow legislation at the city, state, and federal level. It's a lot of memo writing, a lot of what I call relationship building with our elected officials and the wider community in general. So yeah, it's a little bit of what I do right now, work-wise at least. Yeah.
That's amazing.
And where in New York are you based out of?
I live in Brooklyn, but generally my office is at their corporate office in Midtown East.
Oh, cool. Nice.
So we're just totally going to tangent. How terrible is New York? Because John's thinking about moving there, and I'm trying to convince him not to.
Oh, well, so where do you live right now?
I'm in Seattle right now, but
Okay.
it's not that I'm thinking about moving. I will be moving, and I'm going to sign a lease in September or October.
Oh, sweet. Okay, so we're going to be friends, and we're going to hang out without you.
Yeah, I'm down.
New York steals all my friends. It's so bad. Boo.
I'm so excited. You should live in Brooklyn.
I lived in New York for 6 months last year.
Oh, okay.
And I lived right by Prospect Park. So Crown Heights
area. Yes, that's where I live right now.
In Crown Heights?
I live in Prospect Heights, so a little further,
nice.
Just directly west. Yeah.
It's a good area.
Yay, that's exciting. So I'm glad we're having this call right now. So
yeah, this is part of my plan. I want friends to be friends.
My company moved to near Times Square, 51st and Broadway. So it's a little bit far out from it used to be in Fidei, and so I was really wanted to live in Brooklyn, but I also want to walk to work, and so that might not be the best option. Yeah, I think I will be probably living in the city which
Okay.
I'll see what it's like.
Oh, well, then I actually will never see you. So just too bad,
you
too bad.
you work in the city though.
I mean, not right now. I work from home. Oh, it's
I
okay.
see.
They are making us go in the office though in the fall, so I probably will. I'll be there. It'll be easier to get a hold of me. But generally, I don't like to go over there.
Well, you
Well,
guys are
if
going
I
to
know.
figure this out. Anyway, on to the next topic. So
Okay.
I want to know a bit more about what JT actually does. That's truly my goal. Like I know that you were on a Pomona podcast a month or two back, and I listened to it, unlike you not listening to our show yet. But I won't hold a grudge. With that, I was wondering just a bit more about one, why you chose that field or ended up in that field, why you're studying it, and then kind of what is even the heartbeat on that in that field, because that's actually a totally opposite and tangential direction from what John and I know. And that's one of the big reasons why I was like, how do we get someone from totally left park to come on and see how we do on learning about things?
Yeah. Sure. I mean, initially I started off just being like, oh, like I'll be a doctor when I grow up, blah, blah, blah. That didn't work out. I'm not good at science or all those bad. I'm not good at test taking. A
You're
bunch
probably
of
better
like,
at both of those things than you and I are, by the way.
oh,
Without a doubt.
I'm not good at the memory stuff. I am okay at like logic stuff. Like tell me like math and logic puzzles. That's fine with me actually. But whatever it was, I don't know. Science wise, I'm really probably not better. Anyways, I'm probably not better than either of you. But um, science wise though, it was bad. But I wanted to stay in healthcare. I thought that was where I could make the most impact, where I could feel good about what I'm doing and have an impact like it for the better on like the wider society. And it was still something I'm interested in. And then also just, yeah, I think I was interested in the more holistic aspect of healthcare and just the wider how things all like connect and stuff, from a macro perspective, which I think that's where like public health comes in, because it's more you treat stuff from the preventative approach instead of treating when something's already going wrong. So I think that's what I'm interested in most, is just trying to prevent problems from happening in the first place. And yeah. Did I answer your question?
Yeah, that's fantastic. No, it's so cool. And so now in the space, so you're now working at the Presbyterian Hospital, and you are doing kind of, you're a connector between government / public policy and the hospital / Presbyterian Hospital itself, and just trying to keep things running. Is that it?
Yeah, so I connect the hospital with the policymakers on the ground, basically. So talking about things from the public health perspective, I guess. So I mean, on the wider level, people like all the government elected officials pass policies and legislation that affect healthcare. So on that front, we're just monitoring what we think is best for our healthcare system in general, and like advocating for policies that are targeting more like preventative care, or policies that improve public health or health justice. So things like that, because so as like a representative of the hospital, like I'm like advocate on behalf of the hospital, I'm like advocating for those policies. So whatever the hospital is supporting and tells me to advocate for, then that message is relayed to the elected officials. And in turn, also because hospitals can be a big backing of like political organizations and stuff in general. A hospital has a lot of money. I think that's where our power comes from. So I think because of the influence hospitals have, they can listen, they will listen to what the hospitals want also. I mean, like, obviously nothing, like, there's going to be a lot of back and forth and compromises made, but ultimately the hospitals do have a lot of power making, like power behind their lobbying compared to maybe a smaller organization and stuff. The hospitals have a lot of money behind what they're advocating for. Does that make sense?
Sounds like a pretty unique role that you have. And so is it the case that you're the only one at the hospital who has that specific role? Or is there a team of people that does that?
It's kind of, so I'm part of the team, but the team is me, my boss who's the director, our VP of the bigger department, and then we collaborate with some of the same people at the Weill Cornell campus and the Columbia campus. So those are their two other medical school campuses who have their own government affairs or government relations representatives also. But actually, so overall though, for such a big enterprise, it's actually a fairly small team. We're nothing like, I don't know, finance or marketing or stuff where it's like, we're really a team of like smaller than 10 people. So like with just me and my boss and my boss's boss, it's like 3 people just within our team. So it's not very big at all.
Oh, do you feel like that's a good role for you in terms of your interests and your skill set? Because
Yeah.
it's very different from other like hospital jobs where you're interacting with patients or you're like on the ground floor.
Yeah, I mean, there is a lot of stuff that goes on behind the scenes at a hospital besides just like what I do. There's like a lot of other administrative roles behind the scenes. I do enjoy, I mean, a part of why I enjoy the stuff I do a lot is because I like my team. I like the people that I work with, like just directly on my team. So in terms of a good fit in my interest, that's what I'm still exploring, I guess. I don't really know at this point. It's been almost 2 years in this current role, and I think there is still probably room to grow, and there's also room to kind of explore some other avenues and stuff of where to go from there. I think maybe potentially I was exploring maybe going into more operations at the hospital or like a healthcare admin role that was a little different and more involved with the day-to-day operations and administration of the hospital rather than something. I guess my job is more about relationship building. So I don't do as much, I feel like, in terms of it's hard to operate, it's hard to quantify the stuff that I do a lot too, which is why I'm trying to work on editing my resume and figuring out how I can put that into more tangible outputs, I suppose, because we don't actually have a lot of that in what I do. It's not like, oh, like we improved this and like saved this much money or whatever, or just or made this much money this year, or just like helped this many patients through whatever. It's like it's much more abstract. So I'm trying to figure that out. So yeah.
I'm super curious. So in the current role that you've been in for around 2 years, you say, and as you grow, you might transition. But for what you've done, I've actually been really curious to ask, what are some initiatives that you've kind of taken on, worked with, got through, or didn't succeed on, and how was that process, and what were they?
Yeah. Well, it's interesting because I feel like there's not really ever a start to finish end project that I do in my role. There's like things that come up, like big events. Like for instance, we had a huge primary in New York recently. So the other day, like 2 days ago. So I craft the memo and drafted the whole memo to it to just give out to our senior leaders so they're aware of what's going on. And this is important just because we have a huge turnover in our local like offices. It means that we have to start thinking about who is replacing the current elected officials because we have to start building relationships with the new people coming in. and then and build a rapport with the new city council members, the new mayor, things like that. We have to start back over and building our rapport with these people and building our relationships. So so that's just one small thing. Like project wise, it's like maybe we've worked on like trying to do voter registration initiatives at the patient level, like putting up posters, developing the posters, trying to decide where to put them up, and then actually like sending them out and putting them up and seeing if we can get more people to register to vote. I guess that was one initiative. And then another really just bigger day-to-day project that we work on is just, I mean, it's still the same thing that I have trouble with. It's just like basically figuring out how we determine what our outputs are in our job. I think that has been a big conversation within our team, just figuring out, like, we have this many interactions with elected officials like in a year, like whatever, like 500 phone calls, 400 emails, like blah, blah. And so that's kind of like what we're trying to track, and how to and just like how to, I guess, record what our impact actually is. And that's been a project that's just ongoing, that we go back and forth in between, but it's also just very hard because it requires us to do things, like very little things that sometimes can get put to the wayside because we're like dealing with a dumpster fire that day of something else or whatnot. I don't know if I'm rambling or saying things that don't make sense, but
no, it's so cool.
If you have any words of wisdom for anyone who's younger, who's interested in doing similar work, what recommendations would you have for them?
I mean, it does align with what I did even in college, technically. Like, I was technically a public policy major. I say all this technically just because I feel like I don't do the same thing as whatever I actually learned anyways in school. So
yeah, I know that feeling.
yeah, so I was just like, yeah, like technically I'm a public policy major. Technically I am also just like interested in public health, like all this aligns because I'm doing healthcare and like whatnot. I mean, my only advice is that I don't think I ever really expected to end up where I did anyways. I just kind of went through the motions a little bit and just landed here. I'm not very good at offering advice besides just build a relationship with the people you meet, network a lot, make a good impression. I think I got to where I am today basically just by just like talking to a lot of people and just like making a good impression, putting in the work and stuff. Like, I think while sometimes I'm not like in the details very much. I'm the person that's usually like more out there talking to everyone. I think that's what makes a huge impression. I guess I'm not the person that normally sits at their desk and just like does the work and then goes home. I like to like talk to the other people, build relationships, whether or not like they even are on my team and stuff. I think that's the key thing more. I'm just like the office like wanderer. I'm still doing my work. Like, it seems like I just don't. It seems like I'm saying that I don't do any work. I just wander around the office.
Sounds like you do a lot. I mean, from what you were saying earlier, it's kind of crazy. Keeping track of 300, 400 impressions with local/state representatives to push public policy through.
I'm just gonna say amazing. We're doing a bad job of that. We have to a little bit. I'm really bad. It's because we have a really bad database. There are other people trying to figure out how to make it better, things like that. Like, the database is really bad. That's why we don't want to use it, and it's hard to track. It's not very user friendly, basically. Like, the user interface bad, everything's running slow. We need someone that can fix this. So yeah.
Do you want to talk about outside of work stuff? Do you have any more work questions, Hugh?
No, I think the next question is going to be awesome. I'm excited. So Jackie,
Okay.
John has a question for you.
Oh, I was expecting
What?
a question from you, Hugh. Oh, I was just wondering what you're into outside of work. Like, what do you do around that very hip area with a lot of good food, a lot of with Prospect Park right there.
Yeah.
I'm describing it because Hugh has never visited, and he should find out for himself how great
Yeah.
it is.
Well, definitely once you move, also, Hugh has a reason to visit both of us. Not even
Right?
like if outside of work, I mean, so like I do the usual things like hang out with friends, eat and drink out at different places and stuff. Most of my time is usually taken up by, Prospect Park. So especially during the pandemic, it's been running around Prospect Park, biking loops around Prospect Park constantly. So I'm like outside a lot. Most of my free time is spent working out outdoors at the moment. So training for like different races and stuff. Yeah, it's
Like
like the New York.
marathons?
Yeah, so this year I have the New York
Whoa.
City Marathon in November, and then I have the New York City Triathlon coming up in 2.5 weeks. So that's
Oh shoot.
super fun. Oh, and I didn't tell you, Hugh, I finally got clips. I'm actually clipped in riding my bike now,
No.
like a real person.
Wow. You're not using cages?
I never even had cages. Yeah, I never had cages.
You were doing tries with pedals?
Yes, I was. I was. That's how much of
I
a noob I
forgot.
was.
Oh, that's so funny. I love it.
So
I love it.
yeah,
I love it.
that's
I
because I
signed
was afraid of falling, but now I've fallen a couple times on my clips, and now I'm like, fine, it's usually dumb falling. Like I'm actually just at a stoplight, and then
That
I
is
like
the
topple
classic
over.
play. And you like look
Uh,
and you like watch, sometimes you like look over and you see like a car driver, they lock eyes and you're like, ah. And
it's
you like
just like
trip.
the dumb. Yeah.
Clip out.
I signed up for the New York Triathlon last year,
Oh
and
yeah, nice.
it was canceled. So I mean,
Yeah. Wait.
I never did it, so not nice. But
Well, when did you live in New York actually last year?
from the end of March until the 1st of October.
Wait, so why did you live here during the worst time? Like,
I when I moved, it was very unknown. So I thought maybe this will last 2 weeks and then I'll go to an office. Like I started a new job. I was starry-eyed, moved across the country. And
oh,
yeah, I
that's
was
so
there for
funny.
6 months.
You literally moved here after the pandemic even started.
It was
Like
crazy.
right of,
I remember him telling me, he's like, yeah, I'm moving. I'm like, isn't it mid-pandemic and it's like getting hit really hard in New York? He's like, eh.
oh yeah, just gonna fly to the epicenter instead.
It was great. It was amazing. I was like, wow, all right.
Just to be
Yeah.
locked down. You're like, all right, I'm gonna fly over here and then just never meet anyone else because everyone's at home. It's like
Oh, that's good. So
okay.
New York is kind of like opening back up, which is really cool, and there's a lot of stuff to do there. And so something that just on the extracurricular thing, and this is again, I've always wanted to ask, still haven't. You're also, from what I understand, a doula on your free
Yes.
time. Can you
Nah,
describe
yeah.
that? Is that something you're like? What is that? I've never understood.
Yeah. So I haven't been doing that because of COVID. So I can talk about what I was doing pre-pandemic. So
People still give
um
birth though during
huh?
the people still give
I
birth.
do. It's because I'm not at first I'm not a birth doula. I'm trained as one. I just don't really do births. It's like a big time commitment that it's hard to do with a full-time job. So doulas though, yeah, typically they provide emotional support for people who are giving birth or like pregnant person. So they'll provide like they'll meet with someone who's pregnant. They'll meet with them for like a few sessions before their due date, and then around their due date they're basically on call for like 3 weeks. And so basically they can be called at any point to go to the hospital to like to help the person give birth. And so at that point, they'd go there, provide support, whatever support that person needs, and then they'll do some postpartum visits to check in and see how like the baby and the mother are doing. That's really typically it. They're just someone that's there to help a parent or someone that's having a baby with just whatever they need during that time period. So for instance, potentially like if they have a partner that's not able to really be there or doesn't really know what they're doing, then this extra person is like good for having that. And especially, or if someone doesn't have a partner to help them through all this and doesn't have family or a good support system, like then this person's a good person to have to like help them through this process. And it really providing the emotional support and just that extra support. There's been lots of studies that this helps like in either just like sort of reducing like preterm births or reducing like just the risk of like other adverse outcomes when it comes to people giving birth. And so we have like one of the highest maternal mortality rates. So having like doulas and midwives and other sorts of support around that area has been proven to like help with that. So yeah, so that's really from the surface level, it's what most people think doulas do. The other part is because I'm a full spectrum doula, and this is what I was trained to do first. I do doulas for abortion. So I go to Planned Parenthoods and like other clinics that are doing abortions, and I help patients that are undergoing abortions instead. And just sit with them through the procedure. So it's a little more different. It's not like I'm not assigned a patient that I go through with them throughout the whole few months process. I just go to the clinic that day. I sit with them, whatever patient, like maybe there's like a list of like 10 different patients that come through. And so usually we just, whatever patient we have, we just go help them through the procedure and then help them process and like leave, and then that's about it. And just a quick in and out for that. And it's a little easier for my like I guess schedule, just because all I have to do is show up to the clinic that day, do whatever patients are that day, and then go home. Whereas doing births would be more of a burden when I used to like be in the office and stuff. It's like hard for me to be like, oh, like what, like if someone called me to be like, I'm having a baby right now, then it'd be hard for me to just get up and go. So that's why it was hard for me to plan, and I couldn't really do births. Although I did get trained to do some birth stuff too. I haven't actually put that to use yet. But I suppose working from home, I could have tried to do it now. And maybe there's still time to take some of that on, but I've not been able to witness that yet. So usually I just help people go through their abortion procedures.
Wow.
Yeah.
Is there like a doula certification board? And like, is there like I'm sure there's like training for it.
Yeah.
Like, how does that work?
There are different trainings. The stuff that I do is all volunteer based because I'm helping people that can't afford doulas, because usually a lot of people that are professional doulas, they have to make money and charge for their services. But then there's also the gap of the people that can't afford to pay for one in the first place. So I volunteer for an organization that does these services for free or at low cost or sliding scale, depending on what income level the patients are at. And then with the abortions, we just partner with clinics basically, and then we show up like we're just doing this for free. So, and then, yeah, there are lots of other trainings out there. The one I did was just through the volunteer organization I help out with. And then there's many other trainings that are out there and certifications and stuff that you have to pay more money for. I think in general, we don't like to support necessarily like mandated certification, because that becomes a barrier for people to like not be a doula if there's mandated certifications. There's a bunch of legislation that was out there to mandate doulas to have certifications in order to get Medicaid reimbursement and stuff. And I don't think can articulate it well enough to go too deep into it. But basically, like our volunteer organization was against any sort of formal certification process because it can be a hindrance and burden, especially to people of color to become doulas if there's any mandated certification and stuff. So yeah, and I hope I like didn't butcher that in any way, but something along those lines.
JT, you rock.
Oh, thank you.
Yeah, spending your days off of work, like volunteering and like literally just like connecting with people who are at a very vulnerable time of their life. So that's super cool. A lot of respect for that.
Thank you. I miss it. So yeah, I haven't been able to do it for the past year and a half. Yeah.
Is there one particular like interesting tidbit that you learned from the training process, or like one like awesome story that you have to share?
Not in particular. I mean, there's been lots of cool moments. Like, I mean, I like get to know like people that come through, the different patients. There are just like the people that we see come through the clinic are from all different sorts of walks of life, ranging from different ages, and just yeah, and there's like sometimes they don't, if they're not in a chatty mood, they don't, like, we don't need to talk to them. We just like hold their hand and they're fine, or they just fall asleep with the medication they're given. And so it can be very chill. And also at other times, like I have to be more like on top of my small talk game and like try to distract them and like ask a lot of questions and stuff and be really on instead. So it really varies. It used to be such a big thing where it's like, yeah, like I just have that one day a week, like about like once a month or so that I did this once or twice a month. And it was really nice to have that built into my schedule and have that. And now, so hopefully come September or so, once things are more set, that I can start doing that again. Yeah.
I'm really curious. So it sounds like it's a really large emotional burden to take on that role, to be a supportive figure during times of possible trauma and pain, and especially in that category that you're working in. So when you're doing that, how do you maintain yourself? How do you like does it emotionally drain you? Do you feel more emotionally good and feel more energized, or how do you recover from that if you do, or is that your recovery process by helping out?
I guess I end up compartmentalizing it after a while. Like it can be, since I do it on Saturday, I used to do it when it was like Saturdays from like 9 to 5 or something. So it's a long day on Saturday. But I think it was like very rewarding. The day goes by really quickly. I mean, and it's not like a full 9 to 5. It's like can start late or like end early and stuff too. But yeah, like after work, after the session, the shift ends, and I just I go home, I do whatever, and just kind of usually, sometimes it's like a low-key night. Usually I'm not doing too much after it. It's pretty chill and decompress and things. But I guess I just enjoyed it a lot, that it never seemed like such a big burden at all. I think my social energy is usually drained just because I have to spend a lot of the day talking to people.
Yeah.
I can't imagine doing that every single day, but I think it's because I have an office job I'm not interacting with people all the time, that it was fine. Like I can't imagine. And this is why I know, like, if I can't be a frontline clinical worker, because they're doing this every single day. And that's tiring. Whereas I'm doing this like once or twice a month. So yeah, for me, it's not too bad. I enjoy it. And like, on my lunch break, I really take my lunch break. I can go out and just like have a nice sit down lunch for an hour and come back. And it's really nice. It's a nice day for myself, really, because I'm just kind of spending time with all these people I don't know, and then taking time for myself, usually in the middle of the day. So yeah.
That's amazing. So like of all the different ways in which you could spend your free time and even go and volunteer, of everything, why is it that you picked being a doula, and how did you end up being a doula?
Yeah, a lot of it was because when I started my grad school program, I learned more about doulas, and just and then one of my closest friends, she was trained as a birth doula, and so one day we just signed up for an abortion doula training together to volunteer at that, and we just ended up signing up for that, doing the training together during grad school, and just started to do that in our free time during school. Cool. So really, I just carried on that to like after grad school ended, I wanted to find opportunities to continue doing that because it's really rewarding, and I like that because I mean it's a sort of a frontline role that I don't really need any proper training for. Like it's really actually hard to find things to do, I think, clinically or just like at the front line that you don't have to do training for. Like I can't be a nurse or a doctor or like anything like that, but I can provide that emotional support to people and just kind of do that. And like it requires a good training and just like being able to do that. But I didn't have to do as much, like I'm not certified in really anything else. I just like help out with that sort of area. So
got it. How long was the training?
Rewarding. Yeah.
How long was the training?
Usually a week, a full weekend. 2 or 3 days.
Nice.
You and I can do it.
Right?
Yeah.
Well, that's amazing. Oh, and what's the group? I'm just curious.
The Doula Project.
Cool.
Yeah. So they do a lot of good work here. Yeah.
That's awesome. You're inspiring. I don't know about you, but me to volunteer.
Yeah.
I
I know. Yeah. In my free time, I did figure out how to virtually volunteer for kind of a similar thing. It's like I started doing case management stuff at home, like intake case management for another organization. So that is more that was more of a time commitment, and I'm less like it's hard for me to commit to that because it's a full week usually of taking phone calls from patients and just like and distributing funds and stuff and different things. It's a lot of phone calls. So I've taken that up, but the virtual stuff, volunteering can be, I feel like, actually more tiring for me than going in person once a month to something.
Amazing. I think it's so cool to hear kind of, excuse me. It's so cool to hear, your past, present, and future type, or past and present type ways in which you've, grown and become part of the community to support and play your role. And so what I'm a bit curious is, how are you now thinking about your future and progressing into whatever you want to be doing? Like, what are some of the frameworks or goals or principles that you're kind of like running with to try to, I feel like JT and I really bond in a certain way where JT, where we're a bit like, I don't know what we're doing in this world. I'm just kind of like on this way or that way. And I feel like Jackie is really has a bit more drive than I do in certain ways too, which I've always respected. Like you've got a master's. What have I done? And you're going down public policy, and it's amazing. So with that, I'm actually curious, like, what is it that you're kind of aiming towards pursuing in your career or outside of your career? Not even, it's open-ended question, I suppose.
Yeah, like that's what I've been thinking about. The thing is, I'm just like, oh, I don't know what I'm gonna do. But I've just been in this role. I enjoy it. I like my team. And I guess the question is always for me is where do I go from here? It's been hard because there's like, I feel like I've taken all the steps I've needed to just be where I am now. And now it's like harder to think about a next step because I've done it's like, oh, like I already have a graduate degree now. I was like, oh, like I'm not like, I don't need another graduate degree. Like, why am I going to go back to school for? Like, I think it's more thinking about what I want to do next now. I think it's harder because now this choice is up to me rather than before. I think it was just like, oh, like whatever job I can get, like I'll just take, like whatever. And now the next steps are really totally up to me, which is why it's a little harder because I don't know what I want yet as the next step. And I feel like sometimes I'm just going through the motions, just being like, all right, so I've been here for 2 years or 2 or 3 years. Now I need to go find another job and move on to the next step. It's already been, it's like what us all millennials do. We like move from job to job, like all the time. It's so like, it's like you can't sit still, or it's like the only way to really tangible, like the only way to actually like get promoted or like make more money or like get salary increases is to like move jobs. But in a way I feel like I'm just, and that's why I'm reviewing my resume and I'm gonna apply to jobs. But the only thing is I don't know, and like I would like to be challenged too. Like I like being challenged in my work and like growing and stuff. So what I'm saying is that I guess I don't know if I'm going through the motions because I think that's what I'm supposed to do, or if because that's what I want to actually do. So, like I feel like potentially I'm just trying to move up to like get promoted or try to go to a better position just because that's what I'm supposed to do, not because I necessarily want it. So I'm not sure yet if that's. I'm not sure what to do next. So yeah.
How does that make you feel? I'm curious.
This became a counseling session.
Oh, I don't know what, I mean, I guess it makes me feel confused, but like, I want more responsibility. At the same time, I do want more responsibility. Like I want to like be more independent, be given things that I guess like, I want to be given a little more room to either like make mistakes or like mess up a little bit rather than I feel like still like I'm still kind of like learning from I don't know, I guess I don't feel like I fully have total independence yet where I'm like managing things that can possibly I don't know what I'm necessarily saying, but like I guess I would like more responsibility and independence in whatever job I have next basically. So not that, but I really enjoy my job right now. So I don't know if, yeah, I'm just like confused trying to figure out the next step. So
Disclaimer, if JT's managers are listening, she loves her job and may stay forever.
But she does want more responsibilities.
Exactly. But hear that. The way to keep her is to have her grow into more responsibilities, or she feels more driven and allowed to fail in a certain way by growing and doing things more responsibly.
Bonus question. What was your event in swim?
100 back. Well, technically 50 back if that existed.
Sprinters. Let's go. Sorry, Lil B.
All right. Are you a swimmer?
I was primarily a water polo player.
Oh, okay.
And swam to stay in shape during the off season.
Yeah. But you were gonna do the New York City try. So I mean you know how to swim at least. That's the hard part. And then the other parts you can just learn. Yeah.
Yeah, I'm doing the Malibu triathlon in September.
Oh, nice.
So, yeah, if you want a training buddy, like if you want to like just do a
great.
triathlon tomorrow, like
actually once you move here, yeah, all my buddies moved away, so I have had 0 training buddies. Then now we're gonna work out together too. So.
JT's a terrible person to work out with because she actually tries hard. Like when we were in Edinburgh, we would go to the pool and she would she would have a paper printed of like a set of X thousand yards. And for me, I'd be like, why are we doing 10 100 right now, Jackie? This is
I
terrible. And
don't
she's like,
remember this.
and you're like, oh, I don't know, let's swim.
He's
And
like,
what
why can't we just warm up the whole time?
yeah, dude, why can't we just bop around for like 800 yards? No, I have a full 4K, 5K. Oh, okay, cool, Jackie.
I don't remember this. I didn't like
Yeah.
swim at all. You're the one that tried to join the swim team, and then I
I
like
was
didn't
on
go.
the swim team.
Oh yeah, you did.
Someone stole my water
didn't.
polo suit. It's so sad. I'm so sad.
Oh.
Where are all your friends going?
Oh, they already left. They went like to California or Chicago or whatever. It's like also people that all my friends that Hugh knows. So there's people that I trained with in college and stuff, and they left.
Smart people.
Where do you train? Do you go to like the ocean or like the Hudson River or something?
The ocean. I have not swam the past year. That's the one thing, because COVID shut down the pools, and then they brought back the pools, but they didn't bring back the pool I used to go to, and I refused to join a new pool. So anyways,
Swimmers
that's
so
where I
picky
am.
about their pools.
I was like, I guess I'm just not gonna swim.
I swam at our local gym. We don't have many gyms with pools, so we have one, and it's only 4 feet deep. And I keep pushing off, and like when I do a flip turn, I'm like, oh my god, I hit the bottom again. It's so annoying.
No. Wait, so where do you go on your long bike rides and stuff? Are you good at biking now? You're probably better at biking than I am. I'm like really.
Oh, when I was in Brooklyn, yeah, I went on a bike ride pretty much every weekend.
Uh-huh.
So the longest we ever did was we went to Cuomo Bridge and then we crossed it. And then
Nice.
we
Yes,
came back.
yeah.
But
The locals here call it the Tappan Zee Bridge before it was renamed the Cuomo Bridge. So you got to call it Tappan Zee Bridge.
okay, that explains why someone said, I've never heard it named that before. And I was like, isn't that the name? Like I had looked it up like a week before.
Yeah.
Tappan Zee.
Tappan Zee. Yeah, but I've done that one before with my friend that left me. It's nice. So
Oh, JT is intense. That's like an 80-mile bike ride.
no, that's
For
not
a round
80.
trip.
Oh, because you went back. You went round trip. See, we were lazy. We crossed over, had lunch, and took the Metro North back.
Ah, I see.
So like 40.
I was destroyed when I came back. Like it was actually like 79.9 miles, something like that.
Oh,
And
nice.
we were tempted to do another lap around the block so that we could reach 80, but like my legs were not working.
Oh,
But-
well, you can come once you move here, we can do a century ride one time. So
Whoa, I need to
fun.
work my way up because I've just been boxing and rock climbing, so not at peak cardio right now. But yeah, that's super cool. I'm always down for people to bike with. The other one I went to a lot was the 9 West Cafe.
Yeah, and the 9W Market. That's I don't know why it's the cafe. That's what you call it. So
Yeah.
I know what you're talking about. I think you mean the 9W Market.
Yeah. Okay. It's probably a market. Yeah.
They call it market. But it is a cafe. Yeah, you're right. So
there's a market and a cafe, but you're right. You're more of a local than I was a pretend local for 6 months.
well, you did stay. At least you got a lot of outdoor stuff in just because you were here during the pandemic.
Yeah. Do you have any like favorite bike ride?
Favorite, and really just that going up like that way. I think that's going upstate. That's my favorite so far. Like scenic wise, that was good. There's lots of cool trails upstate too, where it might make more sense to, unless we were really good at biking, it might make more sense to just take the Metro North or just like get a car and actually bike and take your bikes up and then just like ride around the trails over there. At some point I want to do from here to Montauk, and they stay in Montauk, but it's like the Long Island. So That's a century ride too. So it's like it would be cool if because the Hamptons are expensive, so it'd be better if you can get a whole house with a bunch of people. Not everyone has to ride bikes. Like the other people can just drive and hang out at the house while they wait
Me,
for the.
I invite myself.
Yeah. So no, you're gonna bike.
Dude, Hugh, I know Hugh can bike. He's biked
he
from
can
San
bike.
Francisco to LA.
Yeah, he's an actual real biker, so he's gonna bike too. So other non-bikers can go stay at the house and just
My dad bods kicked in.
party.
I used to be a skilled man. These days, you can hear it. Hub, 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 hub.
Hugh, I know you're climbing V4s and V5s now, so I'm getting back into it.
Yeah, well, we'll convince you to come out and we'll bike and we'll get a big house out in the Hamptons and just stay for like a weekend and then take the train back. So, or
I can be
like, or
convinced.
if people, yeah, or if people are driving, then we would just hop back on to their car, just put a bike rack in and just go back. But yeah, that, and I'm sure there's lots of cool bike rides out there. So I haven't fully explored yet. I don't know. I only just
Yeah.
got clips this whole time.
It's
Been
okay.
doing rides without clips.
It's okay. I'm not using clips. I got bike shorts like halfway throughout my time in New York. Like I was not wearing bike shorts
Oh.
for a long time.
Wow. that's
Wow.
amazing.
Okay.
So
Wow.
I was
You're
like,
really.
yeah. I was like, oh, my butt feels a lot nicer. Like it's not pain. It's not in pain.
Do you have cages yet?
No.
You should definitely add cages. That is like
See,
it just helps.
he's been going with just pedals too.
Yeah, y'all are masochists. That's what you both are. Oh, that's awesome.
I was like, see, at first I thought I was like, oh, I bet John has all the stuff on. He's been way more into this biking thing than I have. He's got all the gear. But I'm like, now I'm hearing that he doesn't even have clips yet. So I'm like, well, at least I got clips like a week ago, I guess.
I think I will get a legit road bike though. Like it seems worth it.
Oh yes, I do at least have a road bike too. They're very light.
Yeah, I have like a triathlon specialized bike.
Oh, you have a
actually
triathlon
no,
bike. That
it's
was
not.
even
I don't. It's just a bike off Amazon that my friend got.
Okay.
But yeah, one fun thing that my friend and I did was we went bike packing to Bear Mountain.
Mm.
And so we like took all of our backpacking equipment and then like locked our bikes up by a tree and then just like walked into the forest and like slept in a tent out there.
Oh wow, that does sound fun. I think I was looking at routes for that too. I guess my only problem is that I'm sort of like a little more bougie and I don't think I could handle the bike packing because I feel like I want to shower after a really long bike ride.
No, Jackie, I won't allow this. You can't let your Cali girl out or your bougie, whatever New Yorker you've become.
I want a bed and hot water.
No, you're
The
gonna
bougie part comes after when you go home and you shower and then you're back into your bougie house and you appreciate it more.
I want to be like glamping. I feel like I can't be all sweaty and stuff and then have to still just sleep in a tent.
Too funny. You just make me laugh. It's just too funny.
I can't do that.
Yeah.
If I'm camping, I'm just camping. I don't want to put the bike in. I don't know. I don't know what it is, but I can't combine the two. Otherwise, I'm gonna be miserable.
What about backpacking?
Backpacking, fine too, but probably maximum 2 nights.
What's the difference between backpacking and can't wait? What? Are you? This is a classic JT moment. Classic. This is totally classic.
Because on a bike, because I don't have to carry my bike. But backpack is just because you said you went bike packing, so you have the backpack with your shit in it, and then
well you can technically get the pannier packs, right? You do pannier racks.
The ones on the back of the
Yeah, you can also do front pannier packs too, and cross handlebars. So there's like people that do cross country rides like that, and then you could probably pack a pack to then do like a day trip with a one night. excursion, but
Oh,
um,
I'll
There's
consider
it's
always-
it.
possible.
There's always gear for that next thing.
Yeah. Yep.
For
I mean-
for 100 miles, I guess it intimidates me that I have to ride 100 miles and then I have to sleep in a tent. I don't know what it is.
Yeah, no, it's actually really fun. I mean, I know we're probably coming to the near end of our time, but I definitely think panniers packed biking than camping, and biking is actually one of the most incredible feelings. Like backpacking is amazing, but if you have the right gear, I don't know. John's a bit, amazing in that way where he had a backpack on, I suppose, and biked. and that's to me is probably a bit too extreme. I don't think I would do that, especially on like a road bike where you're hunched over. But I definitely think, panniers packed, bike camping, the one time I did it from Lake Tahoe to San Francisco to LA, I'd want to do it again. I want to do it on the East Coast, West Coast, Japan. A friend and I are talking about. Like, I don't know. It's a really cool experience.
I'll go to Japan. I'll do it.
Well, I thought you said you didn't want to a second ago. No.
Let me go.
We'll figure this out.
Myself.
How much you want to pay? No,
I'll think about it.
We'll pay it.
But yeah. But I'll think of it. It sounds fun. I do want to do it at some point. I guess I'm just being a big baby about it. So I'll do it.
The big baby who just a few minutes earlier suggested a century ride.
Right? I'm like, what?
Yeah, because I go do a century ride and then I sleep in a bed. That was one of I take a hot
Such a
shower
big
in bed
baby.
after.
That's crazy. I've never done a century. That's unreal. That's amazing. That would be really cool.
You did your backpacking stuff. You didn't cover 100 miles in a day though? Or
no, it was average 40 to 50 a day. Longest day was probably 70, but most of it was 40 to 50.
And that's still a lot more. I just did a century, but then I didn't do anything the rest of the weekend. So
I did 15 miles the other day, like maybe a month and a half ago. My quads were cramping. I was like, wow,
oh, no.
I'm not in shape for this.
Yeah, I feel like when I'm in New York, I have to train for a few months and then go to Jackie and be like, all right, I'm ready to ride with you, because
she's tricky. She really is. I promise you. Jackie's like, no, it'll be fine. And then she kills it. And then you're like, wait, what? She was the girl on the swim team who could do like 10, 15 pull-ups in a row. And you're like, oh my God.
Oh, it's my party trick.
for the times at the parties when people just have pull-up contests.
Oh,
Swimmers.
yeah, because I'm really the annoying person where I'm just like, pull-up bar. I was like, oh, I can't do any. Like, let's do a pull-up contest.
It's like, bam, muscle up.
Yeah, bam, muscle. For every pull-up I do more than you have to take a shot.
See, I told you, it's my party trick. There's a pull-up bar. I'm just like, they don't see it coming.
My goal is to live in an apartment that has a pool in it, so that I can just go downstairs and swim. That'd be
like in New York. Okay, good luck.
Well, it has nothing else. It just has a pool.
Oh, okay. You can find that in Brooklyn though. My friend has a pool, apparently. I've never seen it before.
Yeah, because I also suspect that no one will use it. And I'll just be the only one that uses it. Oh, Jackie, do you have any parting thoughts or words of wisdom to our listeners that you want to say? Or anything you want to promote?
I don't know. I was like, oh, this product I've been using. No, I don't. I'm not sponsored by anything, and I have zero. I don't know. What's that?
This message brought to you by sparkling water.
Oh, I don't have anything cool to show. I don't have anything appropriate that's cool to show that's around here. Boxed water.
Oh my! Are you serious? You bought? Okay, what? No, you're not buying water in a box. Okay.
I didn't buy it. It was free, obviously.
I don't know. You're the one that says you're bougie, self-proclaimed.
I didn't buy it. What do I have around here? I have such random stuff. I don't have anything to promote.
Cool.
But yeah, this is great, especially because my friend Aaron and I, it was us two like finding new routes and like we would be pushing each other to go further and further, and it was pretty great. But then like anytime we invited anyone else to come with us, they'd be like, "Oh, where are you going?" And we're like, "Oh, we're going like to that place in New Jersey," and people would be like, "You're going to another state?" Like they thought we were just like going across like Williamsburg Bridge or something.
Oh.
So
Oh,
yeah.
this will be so fun. We're gonna go on so many bike rides now.
I'm so excited for you guys.
I need to train for it though. Need to
Yeah, okay.
not
Well,
totally
I also,
embarrass myself.
if you know about like fixing bikes and like the know-how for that, that's the one thing I'm really bad at, because I keep chronically taking my bike over to the shop and being like, is anything wrong with it today? I just need to know. And it would be great if I just learned more about my bike and just know if anything is actually wrong with it, because I'm constantly afraid something's going to happen and I don't know what to do.
Yeah, you should, my friend Aaron is actually good at that stuff, and he also lives in Prospect Park or Crown Heights. Like he's probably like a 7-minute walk from your house.
Really?
Yeah,
What's
he's
his
into
last name? Do
Hong?
I know them? Huh?
He's into biking and stuff.
Oh, what's his name?
Okay. His name
Wait,
is Aaron.
it was Aaron, but I don't know.
I mean, there are like millions of people.
It doesn't really give me any context.
But yeah, I mean, like I'm pretty sure he's like a 7-minute walk from you, maybe a little less.
Well, you should connect us, and then we can actually go. I can go on bike rides with him before you get here.
All right, and then yeah, that sounds good. And then Hugh, you should connect me and Jackie so that I can be the further bridge.
Totally, absolutely. This is great.
Cool. Well, that concludes another episode of the Moon Tea podcast. Thanks for staying until this long, and if you're staying this long already, stay a little bit longer to see the cool outro music and the cool credits. Join us next time. Yeah, remember to like, comment, subscribe.
Okay.
Thanks again to Jackie for joining us, and see you all again soon. Peace.